You bring up community, and that is such a huge part of what moms without a mom's struggle with, because we biologically are not designed to provide everything an infant requires on our own. And yet our society and culture really promotes this idea of doing it all, and being independent and on your own. And what's wrong with you if you can't, right? Well, there's nothing wrong with you. You're not designed to do that.
Greetings, hello, good day, wherever you are in this beautiful, wonderful world. Thank you for joining Truehope Cast, the official podcast of Truehope Canada. My name is Simon and I am your host. Truehope Canada is a mind and body-based supplement company that is dedicated first and foremost to promoting brain and body health through non-invasive nutritional means. For more information about us, you can visit truehopecanada.com. Today, I welcome psychologist and postpartum coach Melissa Reilly to the show. As a clinical psychologist and postpartum coach, Melissa loves to help mums without a mum heal through grief, build community, feel joy in motherhood, and move from feelings of isolation, insecurity, and overwhelm to a place of confidence and resilience. Today, Melissa and I will discuss the difficulty of facing significant life challenges without a key support figure. Enjoy the show. Okay, hi Melissa, good day. How are you feeling today? What is going well?
I am doing well, Simon. Thank you. And what's going well is that right now in Pennsylvania, where I am, the sun is shining and it's a lovely start to the day.
Glad to hear that. That's beautiful. Well, for those people who don't know who you are and what you do, maybe you could just let us know as an introduction.
Sure. My name's Dr. Melissa Reilly. I am a clinical psychologist and have been for 22 years now. And I am also a parent coach. And I specialize in working with moms without a mom.
That's very, very niche-y.
Yes.
Are there many people in that circle?
No, actually, the condition of being a mom without a mom is actually really very common, or it's more common than we think. So being a mom without a mom means that you are separated from your own mother by either death, emotional estrangement, or significant physical distance. So there's a lot of us out there, but nobody is talking about it. So we are often left feeling very alone in that situation. So that is why I decided to start talking about it and focus more on it, so that women that are part of this category feel heard and seen.
That's amazing. How did you niche up into that particular market? From education and then obviously into like practicing. How did that? I'm sure it didn't just like happen overnight. So what's the backstory there?
No, it didn't start overnight. Actually, if you had asked me 20 years ago if that would be what I was doing, I would say no. But it's I think a big part of it was through my own personal experience. So I focused on career earlier in life. So I'm a later to life mom myself. And when I became a mother in my late 30s, I was very surprised by a resurgence in the grief that I had felt for my own mother. Now, my mom had passed away when I was 25 years old. And so I had gone through the grieving process and figured everything was just fine. And like I said, I'm a psychologist, so I figured I knew what I was doing. In fact, I had even taught child and human development at the graduate level several times. So, I knew child development. I knew all about babies. I knew all about parenting. In fact, I helped people with parenting. So when I became pregnant and was going through that process, I began to notice just how alone, insecure, and overwhelmed I was feeling, and recognized that I did not have my go-to person, like the natural people that we would typically ask questions of. in my life didn't exist. I didn't have a mom. I didn't have family close by. And the friends that I was close with, their children were teenagers and young adults. So I was out of sync. So here I was, professional woman, well educated, confident in who I was professionally and personally, having this newborn baby that threw me for a complete loop. And that's when I recognized that I was really struggling. And I started noticing myself longing for my mom. I started re-experiencing a lot of the sadness and isolation I had felt during the grieving process. I also found myself really questioning my own competence, which isn't something I did much prior. So I knew that was tied in with some older stuff from earlier in my life that the grief was retriggering. And so, fast forward several years and looking back on that experience, I still, when I see videos and pictures, it still hits me of just how difficult and alone and honestly, Simon, shameful I felt during that time. I felt a lot of shame over my inability to cope. And that's how I described it. I felt like I wasn't coping. But looking back, I recognized it wasn't about coping. I was grieving and didn't even realize it. So in my clinical practice as a psychologist, I treat a lot of moms, right? And I was very comfortable in working with moms postpartum and parenting in general. And I just started to notice that my clients that didn't have mothers seemed to have very similar experiences, but didn't understand or have the words to describe it. So the more I looked into it and the more research I started doing with regards to, what was out there in the field, I discovered that there really isn't much of anything out there in the field. There isn't a lot of information about the impact that the loss of a mother, whether through death, estrangement, or physical distance, has on a postpartum mother or motherhood in general. So I became very interested and started looking into it more myself.
Just amazing. I think that's to lead you to that type of very particular type of practice it's just remarkable. And I'm sure the fact that it's actually quite mind-blowing that no one had ever really thought about that type of thing before, because obviously it's so incredibly valuable and important. Your parents, and especially your mother, as becoming a mother as well. What's the literature like in regards to parental loss and its effect on adulthood? I mean, there must. I mean, what's the literature like on that?
Well, it's pretty sparse, actually. We talk. There's a lot more information with regards to typical grief or complicated grief. In DSM, there's that new section of complicated grief as well. And its correlation with depression, but there isn't literature that talks about its impact on parenting, and how that becomes influenced. So when a person experiences grief and the loss of a parent, we tend to have not only the symptoms or the experiences we recognize as grief, so the crying, the sadness, the pain, and the memories, but it also impacts sleep. It impacts our desire to connect and bond with other people. Many also experience feelings of guilt, the sense of how can I be happy? How can my life go on when this other person's life isn't going on? And unfortunately, as a parent, that bonding and that ability to connect and the ability to experience joy is such an important process for the developing child to be part of. And so grief then further complicates the bonding and attachment, as well as the identity development of the woman as a mother.
I think it's interesting that I've never really thought about this in too much depth before, but obviously your mother has a very important role as when you're a child to, to parent you and to guide you and to teach you and to keep you safe, and, all the way up to, let's say, 18. And then you kind of like, you leave the nest, you go and do your own thing. But then there's a second stage in parenting when your child becomes a parent. That is an incredibly huge, I've got 2 young kids, and parenting's the most difficult thing on the planet, without question. There's nothing else. If you've not been a parent yet, you've got no idea. But
Right.
There comes this second stage. You have young kids, and you've got this like crazy little thing that you've no idea what to do with, because you've obviously had no past experience of having your own child. And it only makes sense that you would have your parents, and especially your mother, with that, maternal instinct to be able to support you and guide you and just like, give you a helping hand and letting you know that everything's going to be okay. Things come in stages. There's phases here. Everything's going to be all right. But to not, I could not think. And my mum's without question one of the most important people in my life. She is literally a lifesaver. And it's remarkable that we do have that second stage, and so many people don't have it. We have this world now where people live tens of thousands of miles away from each other, or parents don't talk to each other, or parents aren't around anymore, and there's this absolute wild disconnect from when we would have been in very small communities where we would have had all of these generations under the same roof, definitely in the same community, in the same town. And even if that family member was maybe not around, I feel like within a community, like grandparents and other people's parents would have filled that role as part of the community. And it's just quite a remarkable state of affairs. And it would only make sense to me that grief and isolation and depression and all these things would come if that relationship, that significantly powerful relationship, was not even present, and all you could do was kind of worry and be concerned and be anxious about the future and depressed about the past without that individual there. And you would think about that individual and the loss and the grief, and it would just all come rushing back. You would get flooded straight back to that situation where it was really raw and really real and kind of brand new. Really really amazing stuff.
Yes. And I think you bring up community, and that is such a huge part of what moms without a mom's struggle with, because we biologically are not designed to provide everything an infant requires on our own. And yet our society and culture really promotes this idea of doing it all, being it all, and being independent and on your own. And what's wrong with you if you can't, right? Well, there's nothing wrong with you. You're not designed to do that. And so we are built as human beings to be in community. And I can go off on that tangent forever, but there are so many aspects of that. And, one of the things that I talk with moms all the time about is when you are creating a community, is to really look at the strengths of the people in your life and recognize what they are, and then ask them for assistance based on those strengths. So for example, right, I think it's unrealistic for us to expect any one person to meet a lot of our needs in the same way that a mom would. So I always encourage women to find another wise woman. So this would be somebody where they can ask questions of, like, this woman, knows the answers, knows how to find the answers, and can be a provider of that information. Another person should be that emotional support. So who is the person you can just call up and, talk about your sadness and your excitement and your worries, and they just listen, And then another person to be your go-getter, right? I have a particular friend who is really good at getting things done. So if I need laundry done, she comes, gets it, does it. Need groceries picked up, she comes, does it, right? But these individuals, right, each have different strengths. So I wouldn't necessarily call on my go-getter friend to be that emotional support because that just isn't who she is. So one of the things that a lot of moms struggle with is this idea of burdening other people, as if helping us is a burden. That's just silly. But anyway, so I recommend, if there are 4 people in your life, think about what their strengths are. And if you can ask each person to help you for 1 hour a month, and let's face it, no matter how busy you are in life, most of us wouldn't bat an eyelash to help a friend 1 hour once a month. And so you have 4 friends, you're able to do that, then you have an hour of assistance in whatever way you need every week. And that alone can be such a huge benefit to moms that are feeling isolated and alone.
Yeah, what a great way to actually individualize other people's strengths and the people around you, and not ask yourself to do all of those one things, especially, but being able to recognize who does have these strengths and having the honesty with yourself to actually be able to ask for help. I think that's a huge problem in our culture, is we don't like asking for help. We don't like asking for support. For sure, we don't want to burden people, but I think a lot of people just do not have the humility to be able to actually ask for help. I think we have a big problem with that. But yeah, that's definitely step one of creating a community is being open, being vulnerable to knowing that you have limitations and you can make mistakes. But, it's so important to be able to be open, be honest to yourself. And without question, there's people who love you and around you are gonna do everything that they possibly can. And yeah, 1 hour a week or 1 hour a month, I think is unbelievably doable for most people.
Right.
You mentioned a little bit before about kind of what grief looks like at a basic level as like an individual. Thank you for that. Why? I just wonder why it's so easy for so many people to slip into isolation and desperation and insecurity. Why do we do that so quickly, and why is it that we don't jump to community and jump and ask for help rather than that? We kind of slip into a kind of dark psychological hole, and we dig it deeper and deeper. What happens there?
Well, because I think many of the cultural shifts that we've experienced over the last 150 years have really decreased how we as families and communities live our life. So this idea of a nuclear family of parents and children living in isolation, providing 100% of their needs for themselves and being very independent is what is celebrated and promoted in our society. And so to step out of that feels very contrary to what is the norm, when the reality is it isn't the norm. It's what's portrayed as the norm, and those two things are very different. And so then again, when we are doing what is very appropriate, and that's seeking community and being around others, we feel like there is something wrong with us, and there aren't enough of us talking about that. Now, thankfully, I think some of that's changing a little bit. I think with social media, there's both a very positive side and a dangerous side. I think in some ways social media can isolate us further because it can provide the illusion of community, but not necessarily actual connections. But it can also provide some normalization of what is actually happening out there. And I think particularly during the pandemic, there was a real uptick in, individuals kind of saying, I am not okay, and people echoing that. So that was good. But we, again, our bodies biologically are not in sync with the fast-paced nature of how society is changing. So society is changing much faster than we are. And so, podcasts like this become so important for us to normalize how appropriate it is for us to reach out and be with others and share our struggles so that we know where to get assistance and how to get assistance, and that there isn't something wrong with you because you're seeking out what is so normal and natural.
Is there a common type of patient that you have? Like, I'm talking in regards to like the age of the children that they might have. So the mothers that come and speak to you is like, I mean, I'm sure they have kids of all different ages, but is there like an age group of kids that's more common than not, like infants, toddlers, teenagers?
I usually, absolutely full range. But I think postpartum, the first few years postpartum, tend to be the most difficult, and so many women will come in at that time because they're struggling so much, and yet that is a time that getting assistance is so hard because they just feel so overwhelmed. And so I know when I work with moms, I always encourage them to bring their babies in, right? Don't feel like you need to leave your baby. Bring your baby in, and I'm part of that dynamic. And that's also something that I think is really important. A mother should never feel like she needs to separate from her child to get her own needs met. So,
say I'm a father listening to this podcast, and my partner does not have a mother, doesn't have that role, whether that be distance or absence, complete absence. What would my beginning steps be? You know, I like to think a lot of like fathers and men out there are listening to something like this, but what would their what would their actions be? Would you recommend?
First and foremost, patience and compassion, because the longing for a mom does not mean that you as a partner aren't being supportive and doing what you need. So I think it's so important to recognize that you can be the most amazing, loving partner, spouse, companion to your wife, and she still may feel very isolated and alone without her mother. So I think the first step is to be patient, with her and that process, and to know that you are doing what you need to do, continue to support, continue to provide, and encourage her to seek out others in addition to you. Because the way women relate with other women is different than how they relate to men typically. There are actual biological differences in brain function. We know that through functional MRIs and those kinds of brain scans and things like that. But there are differences in the way that male brains and female brains communicate and recognize interpersonal interaction. Now, that doesn't mean that the way we relate can't change or alter over time, and be very loving and fulfilling. That's not what I'm trying to say here. But I want the men listening to this podcast to feel empowered and uplifted, even if their partners still miss their mom despite everything they're doing for them.
And there's so much missing in regards to, I feel like, education and what I feel. I mean, you can't, as a brand new parent, there's so much you just don't know and can't expect, and that you won't read in a book, right, or you won't listen to in a podcast. But there's also, I think there's a lot of things that clearly I could have known before being a parent that I could have been prepared for. Especially there's so many aspects to it. I mean, the stress of it all and the expectation and like what we're talking about like right now with like, you become, when you have kids, I feel like when you have kids, you really find out that you've got the right partner, because you go through the absolute trenches with absolutely everything. And it really like helps you figure out, oh my God, I mean, in my personal circumstances, I've married the right person. There's no question about that. And my two young kids have made that massively clear. But there's so much that we don't learn, whether it's in school or it's in these like mothering classes or in these prenatal classes, that we learn about the birthing and we learn about this and all kind of the practical, I suppose the practical side of having a baby. But the psycho-emotional side of things I feel massively lacking. You know, I was looking for this type of information actively before I had kids,
Right.
because I really wanted to be, you know, prepared. You know, I'm a nutritionist, so I could do the physical stuff. You know, I could make sure I was taking care of my physical body. But what do you think is missing from our education for parents pre-children?
Oh, I think a lot of the psychological work, the experience of, bonding, and how do you connect, and how do you normalize those experiences of insecurity. I think it's so hard to find, the supportive, helpful voices out there. And so, you, I, I couldn't, I couldn't find, many that, I mean, there's this one wonderful book called uh, Motherless Daughters out there, but that's the only one I've ever seen. So, I think memoirs, and just learning about other people's experience becomes really important. I think another message that is so important is just this idea of being a good enough parent. I think there are lots of tips and tricks and strategies, and, we can find those in galore. But it's what is so critical is this idea that you don't need to do any of them perfectly. You just need to do them good enough. You need to show up enough, right? And so being patient and kind with yourself on those days when things are difficult, it's okay. Your child never needs you to be perfect. They need you to be present and the best that you're able to be at that time. So there are days, Simon, when I'm not 100%. I've had a difficult day at work, or, I'm not feeling well physically. And so my best may only be 80%. But I'm giving my 80%. I'm giving what I have and doing the best I can. And when it falls below 80%, then that's when I know I need to step away and replenish myself so that I can get back up to a level that's going to be useful and helpful. So,
Yeah, that
I
takes a
think
lot of
parents need to hear those kinds of
self-recognition
things.
and investigation. No, no, yeah, you're totally right. It's very, very good
Yeah.
advice. I had a question. Do you think that just us as a society, we've complicated parenting so much that we have just more problems than we're supposed to have?
I think in many ways, yes. And I think in some ways, no. There are lots of ways to be a parent, and there's lots of really wonderful literature and recommendations and things out there. But it can be hard to decipher and sift through all of it and what makes sense for you, right? I think in today's culture in particular, there's such a focus on, doing things the way others are telling us to do it without figuring out what works for us. And so we have to recognize who we are and what our values are and what our priorities are, and then live those out in a way that makes sense rather than doing it the opposite. We can't look at things and see how others are doing them and then try and fit them into our lives. So I think that's how it's getting complicated, right? Is by starting on the outside and then trying to make it work on the inside, rather than recognizing the inside and making that work, out in the world. And so I want to, I am very, passionate about how empowering parents in particular to identify what are their values and priorities and strengths. What is the parenting style that makes sense for who they are, not only as an individual, but as a couple, and then promoting how to make that work with the dynamics of that individual child that you have. And then when you know those things, then you can seek out the information and the strategies and the tips that are out there that make sense for you. Because I know you have lots of listeners out there that have read the books or read the blogs and have said, yeah, I tried that and it just did not work. Or, gosh, I got no sleep because I just couldn't get that thing right, right? And yeah, no, it's a little backwards. You have to find the ones
Do
that
you have
work for
any?
you by knowing you a little bit.
I think that's a really great way of doing it, knowing what your strengths are, what your weaknesses are, and hopefully as a couple you're able to really kind of nail that down a little bit and be okay with the fact that everything's not going to go perfectly, because it just certainly isn't. Little children, especially little ones, are just these balls of chaos that we just have to do
Yes.
do our best with, and just enjoy the show, I suppose, because it won't last for nothing when it comes to the young kids lasts forever. That's for sure. That's what I definitely try and remind myself of.
Yes.
Do you have any good books or individuals to check out in regards to people who are about to have kids that can kind of dive a bit deeper into the psychological aspect of preparation, I suppose?
My go-to, but this was very consistent with my style, is I loved Bill Sears' The Baby Book, and so it's very consistent with attachment style parenting. But there are many out there. One of my favorite books, and this is pretty old, but the Best Friend's Guide to Pregnancy, and she. And I forget the author's name, but she was great with regards to talking about the tips and tricks that other people don't talk very much about. But again, I encourage to just experiment, look at a lot of different things, and when a particular style connects with you, you'll feel it, right? You'll recognize, oh yeah, that resonates with me, or oh no, that's a little, that doesn't seem to connect. I can't see myself doing that, right? And go with that. Put that one down, pick up another. Just experiment and explore. Ask your friends what they liked. And there's so much out there now. So
Yeah, that's great. I like that. I think that there's so much out there like now, let's say in the last 10, 20 years of information and different types of trends and different types of therapies, I suppose. But I think a lot of the kind of older school stuff is probably it would have been written and based in a time where community, which is without question the most important factor, would have been a big factor during those times. Let's say like the 60s, 70s.
yes.
So I think it would be a really good place to begin when it comes to kind of researching those aspects. I don't know if the later books really take that into consideration, because I don't feel community is a huge part of a lot of people's lives, I suppose, these days. We're very we're becoming more and more insular individuals.
Yes.
So how do you think that we can help ourselves and to take a bit more responsibility as individuals? I think that taking that first look upon yourself and knowing kind of where you're at, what you can do, what's possible, what's not, it's probably a good step. But you're the professional, so maybe you can give us a few tips.
Absolutely. Well, first, I want listeners to know that if you're feeling overwhelmed and you notice agitation, irritability, and you aren't behaving in a way that feels good to you, that's usually a signal that you need to slow down a little bit, take some deep breaths, and let your body calm down, because something is upsetting you, and you may or may not recognize what that is. And at that point, in that moment, it's just about letting your body re-regulate. And being able to express what you're experiencing becomes particularly important if you are going through a grief process. Being able to share with others your stories, your happy memories, your sad memories, finding those that are open to listening is very helpful. Writing those stories down, writing letters to your loved ones, I find that very helpful. It creates that sense of connection. Also, as we were talking earlier, I think it's important to reach out to individuals that you feel comfortable reaching out to. So I would encourage your listeners to start just making a little list of those people in their life that they want to feel more connected with, and start building those bridges to do that. And then lastly is when they feel like they're on this hamster wheel of not knowing who they want to be as a mom or a dad, is to seek out some additional assistance so they can identify that. I talked about recognizing one's values. I think a good way to start with that is just to start listing and jotting down what they are, and then looking at your day-to-day experiences and recognizing, where you're living those out and where you aren't. But when you start to explore those, either with a psychologist, with a counselor, or even a life coach, you can dive deeper into those things, and feel more secure and confident in that process.
Yeah, that was going to be my next question. Like, what's the line? When do we get to that point where, seeking a professional, and I suppose what type of professional would be the best suit for, let's say, a struggling mother, like would that be a psychotherapist? Would that be a psychologist? What do you think?
Okay, so excellent. It's based on level of distress, right? And so, I want you to think about a mirror. Why do we use mirrors? We use mirrors to better see ourselves. Now, we can see most of ourselves without a mirror, right? I can see most of my body, but I can't see my face, right? And so a mirror helps to reflect things back. Now, the type of mirror we choose depends on what we're needing to see. And so if you're finding yourself experiencing psychological symptoms, so some real depression, sadness, you're having difficulty functioning day to day, you're not enjoying life, a lot of intrusive thoughts are making you feel bad about yourself, the conflict with those around you is escalating. In those circumstances, then I would recommend either a counselor or a psychologist, somebody that can look at is there something that needs to be treated. Okay. And there are lots of very healthy and easy to access treatment modalities, including therapy being a primary one. Now, if you find yourself feeling in general in life pretty good about things, but you seem to feel just kind of stuck, you're kind of repeating some patterns, you're not able to get past certain thoughts that just keep repopping. Now, those situations can be easily addressed by a coach, right? Coaches tend to focus on very specific problem areas, and provide some guidance and role modeling and advice. They don't provide treatment, right? So they don't diagnose or provide treatment, but they do provide, again, a strategy to move forward. So those would be, that's a primary difference. Now, you can have both a counselor, a therapist, and a coach. They're not mutually exclusive. But a coach just doesn't have the ability to diagnose or provide treatment. Does that make sense, the difference?
Oh, yeah, absolutely. Yeah, it's kind of a case whether you're looking for just like maybe that very specific support with something going on in your life, yes, or, I think we know, if we were to be honest with ourselves, whether we, really need to dive deeper and need to help ourselves ask some big questions and come to some solutions with specific therapies. I think it's very, very clear. That's a great answer. Yes. Thank you.
Yeah.
Right,
so
Melissa,
are we using the makeup mirror, or are we using the the analogy? Are we using a makeup mirror, or are we using a full body mirror? The difference between the two.
I really love that mirror analogy. Yeah, that's great. That's really good. Melissa, how can people connect with you?
Okay, so they can connect on me with me a couple different ways. One, on Instagram. I'm at Melissa_Reilly_Sidey. I also have 2 free guides that I'd love to offer to your listeners. The first one is for moms that are postpartum, and it is a guide entitled "Care for Yourself While You're Caring for Your Baby." And that's for moms that are not able to step away from their baby so that they can take care of themselves as well as their baby. And then the other guide is for moms of children of all ages. And that is the Enjoy Being a Mom Again guide. And that specifically targets those moms that are finding that the feelings of longing for a mom are getting in the way of being present with their children. So I will give you links to both of those guides, and I hope that they enjoy that. I also have a website, momswithoutamom.com, and they can connect with me there. But I am absolutely all about connecting and supporting. So at any time, please, I want your listeners to know, reach out. I'm happy to chat.
That's wonderful. Well, I'll make sure that all of those links, and especially those guides, because they sound wonderful. I know a couple of people who I'm going to send that to right away. So I really appreciate you sharing that. I think the more that we can share these type of informations in bite-sized, easily readable forms, that makes the whole process so much more simpler and easy to digest. So I want to thank you so much for coming and talking with me today, Melissa. I think it's wonderful and incredibly unique and powerful, the field that you're in, that you've created. I feel it's massively necessary.
Well, thank you so much, Simon. I really appreciate the opportunity, and I hope your listeners enjoy their parenting journey and have learned a lot.
It's certainly a journey, but yeah, thank you again, Melissa. I really appreciate it. And for all you guys listening out there, you can check out the show notes for any of the links that we've spoken about today. You can get hold with Melissa if you need to. Don't forget to subscribe to the podcast, but appreciate you listening today. Thank you so much. This is Truehope Cast, the official podcast of Truehope Canada. We'll see you next week.